name is Rabebe. I'm doing my master's in ophthalmology. I'm from Kiribati. Well, when we are there, we just look for any place that can offer us some study because we don't have ophthalmologists and no one at all to work with back home. In July, I went back to Kiribati and I did operations, and yeah, first of all, the people don't trust me and I don't have a confidence as well, especially like those people in the politics, and even my colleague, one of the doctors too, is my patient. So when they walk into the operating table, I can tell the reaction. They're surprised that I'll be the surgeon, and they will be like, and I just ask them nicely, you want me to operate or you want another? And then they say, okay, since you're sitting there, then you can just operate. One day after that, they really build confidence when they can see much, much better the next day. So I had a confidence too when I learned that, when I operated on them. I was tensioned because it's people you know. First thing, it's a bit insulting, but I understand. I understand because we've been brought up and knowing that we don't have an eye doctor back home. So I knew how they feel. They might think I'm... People are saying that they are proud to have one from home. When they come out and then they tell me on the spot, like in our own language, oh, it's very good and fortunate to have someone from like a local to do those kind of operations. Women, we always have a lower status than men, but it changed nowadays. Some accept it, some still, yeah, discriminate women, not really, but yeah, they still have lower expectation when there's a lady there. And it's not easy to get a nurse because they always say they are short of nurses. And if one time I went and asked the director of nursing, and what the response from her is that we are not ready for specialization for nurses because we are always short. There's a need for it, and so they send more. That's why I have some. And those are the medical, in Fiji they call them nursing practitioners, but back home we call it medical assistant. They are doing the doctor's job in the out island where there is no doctor. So they see and treat emergency cases, stabilize them, and send over if they need referral. So those are the ones I target them to come and do the certificate for eye care. Those, yeah, I learned this from those that has been done from the other Pacific Island countries. So it's like I'm just trying to follow their roots and learn from them because they already established, well established. We are still trying to form up a picture, not yet, but soon. Pacific Eye community has been helpful, and it's not just helpful, but sometimes they can be a role model as well. We learn from each other, and we're almost the same, It's not easy because we're gonna start from scratch. We just have one room to work with, and they said that if I come back, they can put me to, they can give me an OT day for the major operation theater. And I went home, I operated on my dad. My dad was asking, no, I don't trust you. You have to trust me. And it went out to be a good operation, and then he came and pat my head. Okay, good.